Imagine a novel medical device coming into the emergency department, into the medical care environment, and we need to figure out, does it work? Can it function on the intended patients? Can we get it to patients? Is it a reasonable platform from a usability standpoint where our investigators, both physicians and research investigators, can operate the device? Does the software function? Can we acquire the images we need to get? Part of this feasibility trial is anybody coming in with an extremity injury of the wrist or ankle is being assessed for enrollment. And if they're proceeding to get an x-ray, in other words, if the treatment team is ordering an x-ray, we'll try to enroll them. They go and get an x-ray. That's the gold standard. That's what's leading the clinical care. And then we try to get imaging acquisition on the Accuro XV platform as well, purely for investigational purposes. Can we get this device to those patients, take those images, and do that successfully? Can we do it with the physician operator? Can we do it with the research investigator operator? How much expertise do we need to operate the device? Because one of the big promises of the Accuro XV device is that it can be used by a wide array of operators, and everyone can get essentially the same images, or at least successful imaging acquisition. So that's been key, and we've made good progress there. We are looking, of course, at the imaging analysis for injuries. We are reviewing all of these images. Can we identify these injuries as they're coming up? How do they compare to what we're calling the gold standard in this study or in the next study, which is the X-ray findings? Can we see those fractures that are coming across on X-ray and see how well the imaging acquisition process is working? The other tangible, I suppose, that we're looking at as far as primary outcomes is the level of pain. One of the concerns that's been raised, and it's a good concern, is because ultrasound does require contact with the patient anatomy, and we are looking at patients who have undergone a traumatic injury, and we're well over 200 patients. We are not seeing increased pain over what one would rate during the X-ray acquisition. So these are some of the things we're looking at, and as we've gone through the feasibility trial, we've certainly have improved our ability to get images, our ability to analyze them, ability to accurately represent the anatomy and display traumatic injuries. And so it's sort of an exciting platform for then launching a pivotal trial or a pilot trial in 2025, where we're going to actually look at the accuracy of the device, because that, of course, has to come, and that will be the critical element. Is this accurate as compared to X-ray, as compared to standard of care, as compared to physical exam? And so that will be the next phase once we're happy that the device we have is functioning to the best that it can and does do the main missions of acquiring the anatomy, displaying the anatomy accurately, and again, different operators able to get these images.